Nehawu vowing to continue with the strike indefinitely. Now, one of the worst affected provinces is KwaZulu-Natal, and that's where we find Nobuhle Modise. She is at the Harry Gwala Regional Hospital in Pietermaritzburg this morning. Nobuhle, good morning to you. I see the picture behind you. Are those members of that hospital, the staff that work there? What is going on where you are?
Indeed, so some of these people that are behind me are staff members who are not particularly, affiliated with Nehawu, and then some people behind me, I have to say, are pregnant women who have scheduled prenatal visits who are not receiving any help. And when I spoke to them earlier, they were saying that they're afraid to speak to us because of issues of intimidation. They feel as though should they speak to the media, they would then be intimidated by the time the strike ends. So because of that, they're not willing to speak to us. I did manage to speak to some of the patients that were being discharged and coming out of the hospital, just to speak to them about the service they were receiving inside. And a woman who had brought her son in, who had broken his leg last night, she came in last night to the hospital. She says she was assisted, he was put in a cast, but outside of that, he didn't receive any food and any medication. So he is in severe pain, and as they were trying to get out, you could see on his face that he wasn't coping. And she's saying because the pharmacy is shut down, she was unable to get any help. I then also managed to speak to another patient who was coming into the hospital for help. She's also pregnant, and she had a 2-year-old who was also not feeling well, and she was coming to the hospital to ask for some assistance, and she was then turned back saying that there's no one working. And she's saying that could these workers not have found any other way to vent their frustrations to government. She's saying this is affecting them as people, and they shouldn't be the ones to bear the brunt of what's happening here. There's also the issue of intimidation, where some of these workers who are sitting around here are not affiliated, like I said, to Nehawu, and so some of them are staying away and some of them are here. And you can hear by the songs that some of these leaders are singing, they are also quite intimidating to these who are just sitting around, who just want to come inside and help those who are working. So there's a lot of people who are just sitting around, sitting around on the side, just hoping for this to come to an end soon. And like I said, some of the patients that I've spoken to are saying they are the ones that unfortunately have to bear the brunt of what is happening here. I want to move out of shot so I can show you these ladies that are sitting behind me, but I don't think that's something that I should do at the moment. But truly, as I'm saying, a lot of people are being affected by this, and many of them are saying, aren't there other ways that these workers can vent their frustrations?
Nobuhle Modise, thank you very much for that update.